Hello everyone, welcome to Physiolite. Today I'm going to explain hydrocephalus, which is a neurology topic. I'll be explaining both the clinical as well as the PT of the hydrocephalus, which will be in 2 to 3 videos. I wish you all watch the 3 videos completely. So going into the topic, hydrocephalus, it's a pathological accumulation of the CSF, which will be resulting from the imbalance between the formation of the CSF and its absorption. Normally, the CSF is produced and it will be absorbed. How much ever it is produced, that should be absorbed by the blood or our body. But in this hydrocephalus case, there will be an imbalance, that the ratio will not match with the formation of the CSF and the absorption of the CSF. The ratio between the formation and absorption is imbalanced, or it will be not proper. So because of that, it will be resulting in the accumulation of the CSF in the cranium, that is the skull. So there will be abnormal increase in the volume of the CSF in the skull or the cranium. So here normally our CSF will be produced around 500 ml, and it will be helpful for our brain and spinal cord, that is the central nervous system. It will be the central nervous system, that is the brain and the spinal cord, will be immersed in the CSF, and this CSF will be providing the required nutrients for the brain and the spinal cord, and it will be removing the waste material from the brain and the spinal cord, and it will be helpful to reduce the friction of the brain and the spinal cord in the cranium as well as in the spinal column. So if there is an abnormal increase in the abnormal increase in the CSF production or absorption, or it might be the traveling, there will be a hydrocephalus condition. So normally hydrocephalus is accompanied by the raised CSF pressure, that is the cerebrospinal fluid pressure will be increased during the hydrocephalus. And the one of the reason for the increase in the CSF is CSF pressure is, first one is abnormal increase in the formation of the CSF. So there will be an increased formation of the CSF. Normally 500 ml should be produced, but here in the hydrocephalus there will be more production of the hydrocephalus. The causes will be discussed furtherly. A blockage in the circulation of the CSF. The CSF will be the CSF circulation, the flow of the CSF will be blocked, and that also will be resulting in the accumulation of the CSF. And last one is the diminished absorption of the fluid. I have said you in the definition itself that there should be a balance between the formation and the production and the absorption. If there is no balance between the production and the absorption, then obviously there will be an accumulation of the CSF. So I will be explaining you the flow also in the video. So rarely hydrocephalus also occurs with the normal CSF pressure, that is there will be a normal intracranial pressure also during hydrocephalus, which is very rare. And in this patient there will be compensatory. So if you are not having pressure, I'll give you this. So that will be the case where the CSF pressure is normal. Here in these patients will be having hypoplasia and atrophy of the brain substance. So what will happen when the CSF pressure is normal and he is having hydrocephalus? The patient will be getting compensated. The patient will compensatorily get the hypoplasia and atrophy of the substance of the brain. So what is this means? So there will be a decrease in the brain cells. There will be a very less number of brain cells. So which is also a problem for us. So normally pressure should be increased, or else if pressure is not increased, there will be hypoplasia. So this is what hydrocephalus is. And what are the types of hydrocephalus? That is congenital hydrocephalus, acquired hydrocephalus, normal pressure hydrocephalus, communicating hydrocephalus, and non-communicating hydrocephalus. Mostly we'll be concentrating on this, both communicating and non-communicating hydrocephalus. So these all three will be coming under this only, but normally according to the textbook we will be having 5 types of hydrocephalus: congenital, acquired, normal pressure, communicating, and non-communicating. Communicating and non-communicating are the main types of hydrocephalus, which will be generally, in general terms, we will be describing the hydrocephalus as communicating and non-communicating hydrocephalus. And coming to the flow, production, circulation, and the absorption of the CSF. Normally the production is very stable. Our brain and the body will be having a very good mechanism of producing certain amount of the products, as our body is designed to produce that much only. In case if it is any other thing also, normally if you have to produce something, any other secretions also, it will be producing very stably. if there is an instability, it means that there is an abnormality. So in the case of the production of the CSF also, there will be a normal production. Thus the production will be very stable, that is 500 to 550 ml of the CSF is produced per day, and approximately 0.5 ml of the CSF is produced per minute. If there is an imbalance, obviously it will lead to the hydrocephalus. Where is the CSF produced? The CSF is produced in the choroid plexus of the lateral ventricles, third ventricle and fourth ventricle. The ventricular system is responsible for the production of the CSF. And the CSF that is produced in the choroid plexus of the lateral, third and fourth ventricles. So normally the CSF flow will be caudal flow, that is the downward flow. So the CSF will be flowing downwards, that is from the lateral ventricles to the third ventricles, and from the third ventricles to the fourth ventricles. I have given you a small diagram. Lateral ventricles, there are two lateral ventricles and one third ventricle and the fourth ventricle. The two lateral ventricles will be draining its CSF into the third, and the third will be draining its CSF to the fourth. From the fourth ventricle it will be going to the brain and spinal cord. So here from the lateral ventricles to the third ventricle, if it have to go, it will be going to the interventricular foramina. So here I have given you a diagram. So lateral ventricles, and this is the third ventricle, and this is the fourth ventricle. If the fluid, that the CSF, has to go from the lateral ventricles to the third ventricles, it has to go from the foramen, that's called interventricular foramen, also called as foramen of Monro. And the second one is from the now the CSF is in the third ventricle. From the third ventricle again it has to go to the fourth ventricle. It will be going through another thing that is called CA, that is the cerebral aqueduct. The CSF from the third ventricle via cerebral aqueduct moves to the fourth ventricle, and again from the fourth ventricle it has to move to the brain and spinal cord. How it will move to the brain and spinal cord is, it will go into the subarachnoid space and then it will go to the brain and spinal cord through the foramen of Luschka and foramen of Magendie. Foramen of Luschka is also called as a lateral aperture. So these are present in the lateral side of the fourth ventricle, so that's called as lateral apertures. So foramen of Luschka and foramen of Magendie. Pronunciation will be differing, I'm sorry for that. And also into the central canal of the spinal cord. So and into the central canal of the spinal cord. In the fourth ventricle, there will be three pathways. That is, the one will be going into the foramen of Luschka, and the other will be going into the foramen of Magendie, and the other Magendie, and the last one will be going into the central canal of the spinal cord. From here, it will the CSF will be going into the subarachnoid space. So in the subarachnoid space, it is absorbed by the subarachnoid villi or granulation. The CSF should be produced as well as it should be traveled, and the CSF should be produced and it also should be traveled and it also should be absorbed. So in the subarachnoid space, that is the subarachnoid villi and granulations are helpful for the absorption of the CSF. And here through the tentorial hiatus over the hemispheric convexity, absorption of the CSF occurs into the venous system. So normally from the subarachnoid space, it will go into the subarachnoid villi. Through the subarachnoid villi, it will be going to the tentorial hiatus, which will be present in the brain. And here tentorial hiatus is present between the two hemispheres of the brain. Between the two hemispheres, will be having the tentorial hiatus, which is a membrane that separates the two hemispheres. Over the hemispheric convexity, absorption of the CSF into the venous system, that is from the superior sagittal sinus, which will be in the superior sagittal sinus, dural venous sinuses, in that it will be a part, and then into the jugular vein, that is the internal jugular vein. So this is how our CSF will be traveled. In the next video, I am going to explain you about the causes of the hydrocephalus and what are different causes. In the third video, I'll be explaining you the clinical features as well as the management of this thing. So here I've given you a diagram, that is a lateral ventricle. From the lateral ventricle going to the third ventricle, from there it will going into the fourth ventricle. So stay tuned, please subscribe and share to my channel. Thank you.